And as we continue to follow developments with this deadly virus now in the United States, area hospitals are tracking it as well.
And with an eye on those missteps in handling the virus in Dallas, staff at one Hendersonville hospital today ran through an Ebola drill. News 13's Ashley Searles joins us live in Hendersonville.
Ashley, they're preparing, but these doctors really don't ever expect to have to treat Ebola.
Absolutely not. Staff at Pardee Hospital said they never expect to treat an Ebola case or see one here in the mountains, but at the same time, as a facility, seeing this community, they want to be ready.
We'll bring the patient in here.
If Ebola hits this hospital,
we've already designated this as our negative pressure isolation room.
This is the room that doctors and nurses will use.
After we bring the patient in here, this door will become locked and sealed off. And now we have an entire unit that will be designated for this particular patient.
In a drill at Pardee Hospital this morning, the 10 staffers who volunteered to be on the so-called Ebola SWAT team tested themselves to make sure they had it down, what to do in case it happens.
If you look at the various ways that patients present with Ebola, it could be headache, nausea, vomiting, abdominal pain, fever.
60% of the ER patients here come in with those same type of symptoms. So ER staff here have now begun asking, very early on, have you traveled recently and to West Africa?
The drills that we do in the donning and the doffing of the protective equipment is probably the most significant things that we can do at this point.
Of course, I would be gowned up as well here.
What looks easy, basic undressing, isn't, doctors say. If you're hands-on with Ebola, this requires tremendous focus. When a few drops of fluid on the outside of your suit could potentially kill you.
The involuntary things that you do that would contaminate yourself. As you're taking off this gown and you just go like this, and as you go, now you've just contaminated yourself.
Now, the staff at the hospital say they consider today's drill a success, and they're happy that it went well. They feel ready. At the same time, they say this procedure, their procedure in handling an Ebola patient, is changing constantly, nearly day to day, just as the CDC is constantly updating their recommendations. Reporting live tonight in Hendersonville, I'm Ashley Searles, News 13.